Hello, I'm Marcus Tai. I'm the Dean of the College of Health Professions, and I would like to welcome you to our grand rounds for the College of Health Professions, where today we will be hearing from world-leading experts who are also with Pace University and the College of Health Professions on canines assisting in health. We are recording today's session, and so please be aware of that if you ask questions. And please feel free to tell your colleagues and friends so that they can benefit from the learning that we have today later as well. We'll be posting this on our website. It's my great pleasure to introduce you very briefly to the topic. Canines have many important roles in helping and supporting people with their health, including people with both visible and invisible disabilities. We'll be hearing today from one of our students in occupational therapy, Stephanie Torres, from Dr. Elijah Salzer in our physician assistant program faculty, from Riley Klein, who works with client care and support in ECAD, educated canines assisting with disabilities, from Christine Amendola in faculty in our physician assistant program, and first and foremost also who helped to organize this event today along with development, and Sophie Kaufman, assistant dean in the Office of ALPS. We have Dr. Joanne Singleton, a professor in the College of Health Professions at Pace University. Dr. Singleton is an accomplished clinician, educator, researcher, and coach with numerous national and international publications, presentations, and awards. And I don't have time for all of her many honors, but she helped to create Canines Assisting in Health, CASH, to educate interprofessional healthcare providers on assistance animals to support individuals with both visible and invisible disabilities. She also created the Pause and Breathe program. She works with Professor Spirit, acknowledging the role of assistance animals and their engagement, and not as animals whom we use, but in terms of partnerships with healthcare providers. And that recognition is given in referring to Spirit as Professor Spirit, something which I very much support. And she also has worked with Lou Picard of Educated Canines Assisting with Disabilities, ECAD, as well. And I really think there's a wonderful opportunity. I've seen Canines 101 in our interprofessional education, which Dr. Singleton and our IPE&P committee has put together with Joanne Kniesel and others. And I think there's a wonderful opportunity for scaling this work nationally and internationally in the future, which I very much hope to support. And so now to Dr. Singleton. Thank you.
Thank you, Dean Tai. So welcome, everyone. And we are so excited to have you here with us today. Professor Spirit is here at my feet in what we call a downstate position, which he will stay throughout the presentation. Also on another screen, we have Quinn, who is an ECAD service dog, teamed with Christine and her son, Mikey. He is also in a downstay napping position, and you're going to get to meet a few more dogs along the way, as well as Ben, who is with Dr. Salsa, and we saw him just a moment ago, and he'll come back on screen. And Ileana, you have a guest with us too. So if you have pets at home, if you have service dogs, if you have therapy dogs, please, they are welcome to join us. I want to pick up with something that Dean Tai said, something that I learned in my early work in working with assistance animals, that we don't use animals to help human beings. We intentionally partner with animals. And animals, whether they are canines or other animals, are incredible, beautiful, sentient beings. There is a reciprocity in the relationship, and part of that relationship is part of the therapeutics of working with canines. And so if that's one thing you can take away from this today, language can be so powerful. And if we think that anyone who is working with animals therapeutically is partnering with them, and that there is reciprocity, which also means that the welfare and the well-being of the animals who are assisting humans has to be equally important to that of the humans. And so I just want to share something that I learned very early in this work that has really, really stuck with me. So you know, as well as I do, that Grand Rounds is an opportunity for clinicians and others who are interested in patient care to come together and to talk about ways in which we can improve patient care. Our case today is focusing on what I call non-pharmacologic interventions, specifically assistance animals, and the many ways in which canines are able to assist in human health. Our work in this area, when I began in 2016, was inspired by a colleague who became a very close friend, Captain Luis Carlos Montalban, and his service dog, Tuesday. Both have passed on, but Tuesday actually was given the designation of America's service dog. He is well known internationally as well as nationally. We have had a very long partnership now since the beginning of this work with Educated Canines Assisting with Disabilities. And we will actually be beginning at the ECAD campus with Riley Klein. And Riley Klein, I'm sorry, not Riley Klein, I'm so sorry about that. Riley is going to begin to answer the question for us about how canines assist in human health. So Riley, if you are ready.
Yes, of course. Thank you, Joanne. Thank you to everyone at PACE for including us on ECAD and on this panel today. We're thrilled to be taking part in helping spread the word about canines assisting in health. Yes, there's no shortage of ways canines can assist with health, but let me first talk a little bit about ECAD generally. ECAD was founded in 1995 by Lou and Dale Picard after Lou experienced a personal need for a service dog when her father suffered a stroke and became dependent on Lou as her caregiver. Lou wanted to find an alternative and train the family dog to serve her father as a service dog. And that inspired her to go on to train dogs for other individuals. And we've placed over 350 service dogs with individuals and facilities over the last 25 years. We serve all sorts of clients with disabilities, but there are three primary client types. The first would be individuals with mobility limitations, and that can mean a whole host of disabilities that cause mobility limitations, such as cerebral palsy or multiple sclerosis or physical injuries that result in mobility limitations. And dogs help them with getting around, balance, brace support, getting up from a seated position, retrieving items that may be otherwise difficult to reach. Another client type we serve is veterans. We get a lot of veterans. We just did a graduation that ended last week where 4 veterans left with their new service dogs. Some of them were successor dogs. The individuals have had service dogs in the past. And after 10 years or so, the dogs pass on and they come back and get a successor dog. Those individuals had PTSD, so the dogs serve a different kind of purpose than a mobility dog might. It's much more about comfort and confidence, and also more task-based commands like alerting to night terrors or dissociation, which can be challenging for people with PTSD. And the third client type is children. We place dogs with children on the autism spectrum and with other limiting disabilities. And then we also serve facilities who, there's a whole host of facilities that find benefits in service dogs, therapy centers, hospitals, senior centers, courthouses. There's no shortage of ways that service dogs can assist professionally. And our dogs here learn roughly 80 commands that can be used to help individuals live more independently. And I can describe each of those in detail, but I'd rather show you. So if you give me a moment, we are going to provide a demonstration. Let me see if I can do this here. Okay. So this is Jessica, our head trainer.
Hello.
She's here with Peaches.
Hey, Jess.
Hello, everybody. I can't see you.
I'm figuring out how to work the camera too, but we're going to do a demo here. So I'm going to follow Jess around and try to narrate what she's doing with Peaches. So this is our training center here. And you can see we've got some other dogs on standby. And we've got another trainer over there, that's Zach. But let's focus on Peaches here. So first, Jess is going to do the Stair step stay routine, which is important for people with mobility issues. The dog can provide balance support when going upstairs. So the dog goes one step at a time, waits until Jess tells her to go up another step. And this allows the person to brace on the dog.
Yes, good.
Sorry, I'm working on my camera skills here.
Wait, good, wait, good girl, Peaches. Step, wait. Yes, good girl.
One step at a time.
Step, wait. That's our motto. Good girl. Yes.
Okay, and here we can show some interesting commands that we use the dogs to to tug open objects such as a dryer.
Get it, tug. Peaches, look. Get it, tug, 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 tug. That's it, tug, 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 tug. Yes, good
There you go.
girl.
And the dog
Get it,
can get items out of the dryer.
get it. That's it, get it. Get it, Peaches. You got it. What are you doing? You get this.
It's Monday, so
Get it, get it,
give
get
Peaches
it.
a second chance.
She had a rough weekend. Come here, ready? Get it. Get that, Peaches. Get it. Look. Get this. Get it, get it, get it. Bring it here. Bring it here. That's it. Ready?
Load it into the
Oh, so close. So close. We're gonna try again. Try again. Get it. That's it, Peaches. Ready? Look. Get it. No, what are you doing? Come here, ready? That's it. You got it. You got it. I know you got it. Get it. Get it, Peaches. Come on, Peaches. Get it. That's it. Bring it here. Come on, bring it here. Drop it. Yes. Good
Yeah, all right.
girl.
Load in the laundry bin.
Yes. good
And now we
girl.
can try the fridge.
We're gonna close it.
Oh, we're gonna close it first.
Peaches, ready?
Rob's not done until the
Got it,
dryer's
not done.
closed.
Up.
Oh,
Up, push. Up, push. That's it. Come on. You got it. Up, push. Yes.
There we go.
Yay, you did the laundry. Good job.
now we'll try the fridge.
Peaches, look. Get it, tug. That's it, tug. Yes. Good girl. Peaches, look. Get it. Get it, Peaches.
See
That's
if
it.
she
Get
can
it.
get a water bottle out of the fridge.
Right here. Get it. That's it. Bring it here. Bring it here. Give. Yes.
All right.
Good girl.
Stay
Peaches.
hydrated. Let's close the fridge.
Peaches.
Oh, wait.
Up. Leave it. Up. Push. That's it. Up. Push. You got it. You got it. You got it. Up. Push. Yes. Good,
Good
girl.
girl, Peaches.
Good job.
All right.
You do the automatic button.
And now we're going to show how automatic doors can be opened by service dogs.
Peaches up, push. That's it. Leave it. Peaches go. Up, push. That's it. Push, push, push right here. Right here. Right here. What you looking at? Push. That's it. Push.
Oh, so close.
So close, Peaches. We're so close. We got this. Ready? I know we got an audience.
I think she's a
Up,
little
push.
camera shy.
Peaches. Ready? Up, push. All right, let's switch it around. Let's try it this way. Up. All right, ready? Can you still see?
Mhm.
Peaches, up, push. That's it. That's it. Up, push. Push, push right here. Push, push. That's it. That's it. Push. Peaches, up. You got it. You got it. Up. Okay, let's try it with some treats. Up. Push. Right here. Push. Push, 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 push. You're so close. Push. Awesome. Go right here. Right here.
Yeah,
Yes,
Peaches.
we did it. Good job, Peaches.
So yeah, that was good. I'll give you a quick as I walk past these other dogs. Who we got here? Little pups in training. And then we got Zach, another trainer, who's here with Koi. And Zach is going to show us, Koi is a younger dog. So Zach is going to show us some of the more entry-level commands here. We're going to start with holding items.
That's it. Come here.
I think they're all a little camera shy. You see this guy holding the camera in their face. That's go in. Dogs can go in, which is good for staying in complex spaces, like under a table at a restaurant or in front of the seat
That's it.
or under the seat at an airplane.
That's good. Go ahead. Jump on. Jump on. That's it. Yes. Good girl.
We do a lot of commands on the box. Helps the dog get comfortable in different settings.
Fix it. Fix it.
Fix the leash
Yes.
for when the leash gets tangled under their paws. Shake, because she's very professional. Very good. Do some retrievals. This is watch me. The dog has to maintain eye contact when I'm not pointing the camera at space. The dog looks right into Zach's eyes, keeps her attention.
Look, get it. Get that. That's it, Koi. Get it.
Retrievals,
That's it, look, get that. That's it. Bring it. Bring it here.
bringing the item to Zach.
Yes, good girl. Good job. Yeah. That's it. Jump on.
See if we can get Koi to flip on a light switch.
Yes.
Oh, good job, Koi.
Good job, Koi. First
Koi uses
try.
her nose to turn on the light switch.
Koi, wait. That's it, Koi. Wait. Almost. Koi. Wait. Yes, that was close.
All right. Koi is still in training. She's a younger dog. She's just over a year old. most of these dogs here are young. We just had 6 dogs graduate. So we're back to training the young guys. Here we got some very helpful volunteers who don't want to be on camera. All right. And that was a demonstration of training at ECAD.
Great. Riley, thank you so much. And thanks to the dogs who are working with us. And Jess, thank you as well. And it wasn't that many months ago that Chris and Mikey Amendola went to ECAD for their 2 weeks in residence team training to be matched with who I call the mighty Quinn. He is incredible. And Christine is going to share with you her experience and the experience now that Quinn is teamed with her and Mikey, and they are all back at home together. So Chris, you're on.
Thank you so much, Joanne. Thank you, Riley. It's so great to see my ECAD family. It just warms my heart after living there for 2 weeks. So as mentioned before, my name is Christine Amendola, and I'm the program director for the PA program at PACE in Pleasantville. And I've been with PACE over 15 years, and I've been involved with the IPE committee for pretty much its entire existence. Got a shirt. That proves something. So my son, Mikey, as mentioned before, he's a 6-year-old boy. He attends a local kindergarten here in Hawthorne. I live in Valhalla, so it's the Mount Pleasant School District. He has autism spectrum disorder, he has ADHD, and back in 2019, he suffered a pediatric stroke, most likely due to an unknown injury secondary to his unsafe behaviors. Mikey has a history of elopement and a lack of danger awareness, which is a really bad combination. And there are so many examples that I can tell you that will make your hair stand up. But there are 2 in particular that really drive the point home, and those are burned into my soul, I believe. Actually, back in 2019, we had visited Pinewood Dude Ranch. It's in upstate New York. And we were with a whole group of people. There were 5 adults with us. And Mikey has what I say is superhuman speed. And he ran up ahead of us and right towards a gate that was surrounding a pool that was closed because it was November, it was the fall. And I was like, well, the gate's locked, the pool is closed, but there was a little tiny sliver between the gate and the building adjacent to it. And what Mikey may lack in social awareness and danger awareness, he has spatial awareness. And he fit through that sliver like a squirrel, and he did not hesitate, and he went straight through. Thankfully, one of our friends was an ex-football player, and he jumped the fence and was able to bring him to safety. So that was quite scary. And actually, just last summer, he went missing at a local beach in Long Island for 15 horrifying minutes. Felt like 15 hours. Again, for adults watching him, but if he just gets a little bit ahead of you, he turned a corner and skipped through a cabana and got to the other side. So he was out of our sight, and we found him playing joyfully at the water's edge, no worry in the world, and we were all panicked. So things like that has made our life extremely difficult. We have 3 other children. We want Mikey to live a life similar to them, go trick-or-treating in the neighborhood, go to the parks, go to the games, and I was becoming really desperate, right? Started what anybody else would do, started searching online and reaching and doing my research on the internet. Maybe a dog could help. Could I get a service dog for my son? And when I started the research, ECAD popped up. Now, I had been involved with ECAD before Mikey was even born. I knew ECAD and worked with them. I worked with them with veterans, with amputees, but I had never known that he was my answer to our situation here. And ECAD, as we all can see, is an amazing organization. My time there with them was transformative in more ways than one. Those 2 weeks in December was amazing, and we were able to come home with an additional member to Mikey's team. So that's what I feel in my heart, that Quinn, named after Quinnipiac River State Park, is an addition to Mikey's team. Right? Who else could we possibly add? We had all the teachers, all the therapists, the coaches, the medical providers, but now we have Quinn. And I'm able to tether Mikey to Quinn, which I'll show you a few pictures. And that just really adds another level of security that we've never had before. And it really allows him to have that freedom and all the other opportunities that any other 6-year-old boy does. If Mikey gets really upset or has a meltdown, he's able to give him deep pressure and just calm him with his presence. And he's by his side morning to night, constantly by his side with him no matter where he goes. Actually, Mikey's homesick with the stomach flu, so this is hard for him to be down here. I think he's been up all night with him, so maybe that's why he's a little bit tired. But he knows, you know, Quinn knows that Mikey's his boy. Even though he's got a nice relationship with the rest of our family, it's a different relationship that he has with Mikey. It's a special one. So in our 3 months together, we've gone on lots of adventures. We've been to multiple arcades, including Chuck E. Cheese, which you can imagine is quite stimulating for just anybody, never mind my Mikey. We've gone to the movie theater. We've gone to play gyms, pretty much anywhere a 6-year-old boy would frequent. He's even gone to school. He loves to jump up onto the school bus. He's used to buses at ECAD, so he thinks he's quite at home there. The children love him. I said when I bring him to school, I think I'm more distracting to the teachers because they're all on the floor cuddling with Quinn. So he's been enjoying his time with us. We are planning a trip to the zoo in a few weeks, which is someplace I have not brought Mikey since he was in a stroller, since he was a baby. Just you could think of all the horrible things that could happen to Mikey at a zoo. And we're even planning a trip to Disney this fall. So all of these would not be possible without Quinn on our team. And I can say, and I've told the other members of this committee, you know, one thing I was always worried about was how are we going to be accepted in public, right? How is that going to be now? I have this family of 4 children and a dog, and how, like, they're going to see us coming, right? But everyone's been so welcoming, so respectful, and so understanding, really looking out for our team, going out of their way to offer Quinn water, asking if we need help. I mean, I even got really good assistance in our CVS, and that's never happened before. But unfortunately, the one and only one place that I didn't feel comfortable was the one place I thought Quinn would be most welcome. It was the one place I didn't think twice about it, so I let my guard down. My pediatrician's office. I went for the physical, for their 6-year-old physical. Mikey has a twin sister. So it was me, the twins, and Quinn. And it was the strangest experience. Everyone was really, really weird about it. The physician, the 2 nurses, the office staff. It was the most peculiar, unsettling experience. This is someplace I've been going for 12 years with my 4 children. They knew that Quinn was coming. It wasn't a surprise. I had talked about it. They had done a physical, given a letter, all of this, but it was still uncomfortable for everyone. So right then and there, I was like, I know in my heart that our work is so important, and there's still so much work that's left to be done, especially in the healthcare community. So like if I had one message, it was for us to be part of the solution and not the problem. And pictures say 1,000 words. So let me show you a few pictures of Quinn and Mikey. And hopefully you can see them. Okay, so this is a picture of Mikey and Quinn up in ECAD. He was able to come and visit the first weekend when I was there alone. Him and my family came up for a day, and this is what he does. He jumps right on Quinn's back. So thankfully, Quinn is the size of a horse, as you'll see in some of the other pictures. We always say this might not be Quinn's best angle. Did the picture move? But he is a large golden retriever. He's 80 pounds, which is great because once he's tethered, not even an adult can get away from Quinn. Jess, that you saw before, even tried it on herself and was not able to get away from Quinn. He goes and lays down and is stiff as a board and can't move him. He's an anchor. This is a great picture and just shows their relationship. Mikey is just all smiles. We always say he's the purest of the pure. He's happy from the moment he opens his eyes to the moment he goes to sleep, not an evil strand of hair on his whole entire body. And him and Quinn, they're just 2 peas in a pod. I'm sure Riley remembers this day. There was a snowstorm out in Torrington and we tethered them together. So as you can see, we actually have a dog collar around Mikey's waist because he's so thin. We still use a dog collar around Mikey's waist and we attach it to Quinn's vest. And in this picture, they were out together off leash, but still tethered, playing in a gated space out in the backyard of Torrington. And they were eating the snow, both of them. We convinced Mikey to eat the snow off the wall and not the snow off the floor, especially at a dog kennel. That's where you get that terminology, not to eat yellow snow. So, but this was such a great picture that the volunteers have caught. this is our family there at ECAD that day that we were visiting. So there's my husband, Anthony, and myself, my 2 older boys, Anthony and Dominic, who are 12 and 10. See Quinn, who really rounds out our family, and then his sidekick, Mikey's twin sister, Amelia. So they had a great time up in ECAD, and that little bridge you saw there was used as a play gym by Mikey and my children often. This is a picture of me and Mikey out in the store. Again, someplace now Mikey could roam, do some shopping of his own, attached and tethered to Quinn. We even got to meet Santa, which was so cool. And we were able to even sit near Santa, and Quinn was able to be in the picture. So it was probably the first time Mikey had been with Santa, thanks to COVID. Some familiar faces. Sorry, Joanne, I had to throw this picture in there. We've got Joanne Singleton, myself, Mikey, Quinn, and Spirit when Joanne came up to visit us to do Pause and Breathe. It was just nice to have a piece of home up there as well. This is Mikey's graduating class. So, I mean, each child is cuter than the next, and each dog is cuter than the next. We've got Lucas and Melon, so must be a family member of Peaches over there. And we've got Reese and Romeo in the middle. So, and there's Mikey and Quinn. And it was right around Christmas time. It was in December, hence all of the Christmas hats and the big, gigantic inflatable minion, which I thought was, wow, it's so decorative, until Lou explained to me that, well, your dogs are going to be around your neighborhood, and aren't these going to be there? Now, wouldn't that be frightening for a dog to see? So they were used to it. Quinn came home, didn't even look at my Christmas tree, didn't look at any of the decorations, didn't faze him. Quinn is focused on his boy, and this is a picture of him out there in ECAD. I love that rock decorated the ECAD pups. This was him at Mikey's Boy Scout meeting. Mikey is a lion. He in kindergarten in our local club, and it was an outdoor event in the dark. I was like, oh, this is gonna go good. Quinn is coming. Quinn came, and actually at this event was my first experience with the fact that, wow, Quinn's gonna help Mikey make friends. Because Mikey loves kids his age. He honestly does, but he just doesn't know what to do. He just stands there and smiles, or hugs them, or gets way too close, or just watches from afar. So, you know, Mikey showed up with this dog and was now the most popular boy on the Lions. All the dogs came over. They were very, all the kids came over to the dog. They were very respectful. And Mikey was, as you can see, happy as can be. We took them to the movies for their birthday, because they just turned 6 in January. And Quinn, he came, he loved it. It was the best. We actually went to see Sing 2. So there were lots of animals. We figured that would be really comforting for him. And he enjoyed it. He did a lot of what he's doing now, napping. So this was at Chuck E. Cheese. As you can see, again, Mikey's tethered. While we were there at ECAD, we figured maybe a tether that had a little give. So it's got like a little bit of elastic, so Mikey can get a little bit far and then come back, and not to put too much pressure or strain on Quinn. And this way, Quinn was much more comfortable. And I'm holding the leash, so I'm like the third member of that triangle by his side while he plays video games. And just goes for the, he's there for the ride, right? He goes with it. I'm not sure if he really quite understands why we think arcades are so much fun, but that's where we go for fun these days. And I just had a couple of these pictures of them walking together. I thought they were really cute, because you can see Mike starting to really have that bit of go-getting now, right? Like he's more confident. He's really happy. This is his dog. He's proud, and he's taking a little bit more control. So we really enjoy seeing this team together like this. And he's like, come on, Quinn, we're going, right? We're going to the arcade.
Chris, we want to thank you so much for giving us the example of a case of canines assisting in health. This is a really great example of what life is like for your family with Quinn, and how Mikey is being supported in his health. So thank you so much. We really appreciate you being able to do this today. We know you have to go to another meeting.
Thank you, and thank you for having me. I'll leave you with one last picture of cuteness. That was Quinnipiac as a puppy.
Oh,
thank you, everyone. I'm going to stop sharing. Thank you so much. Sorry to have to run, but thank you.
Thanks, Chris. So Stephanie is going to talk to us a little bit now about our continuing developing partnership with ECAD and a very innovative fieldwork experience that she's had the opportunity of participating in so that she can add to some understanding about how canines are assisting in human health. So Stephanie?
Hi, good afternoon, everybody. My name is Stephanie. I'm a first-year occupational therapy student here at Pace University. So I'll be talking about my fieldwork for mental health, as mentioned at ECAD. So to start off, the first 2 weeks we went to ECAD, we were able to work with the skilled service dogs. So first visit, we worked on commands, as Zach and Jess demonstrated earlier. Lou, our supervisor at ECAD, she had some of us using walkers and wheelchairs within the facility. And then our second visit was very interesting experience because we were able to actually go out in the public and with the walkers and wheelchairs and the service dog as well. So we were practicing the commands that we learned, how to go in and out of the store to keep the dog's attention on us, because there is a high amount of stimulation to distract the dog. So we did some commands such as front, and that is when the dog will go in front of you and look at me. So they'll look at you and you just tell them to go back and they'll be walking backwards, which I thought was the cutest thing and very, really awesome to see them follow those commands. And something I did notice walking around the store, I believe it was TJ Maxx that we saw, I was able to acknowledge that not many stores provide the space needed for individuals who use adaptive mobility equipment, such as wheelchairs and walkers. So we were kind of like bumping into things. I had Josh at the time, and he was bumping into things. So I thought that was very interesting experience to go through. The last 2 visits at ECAD, me and 3 of my classmates were able to meet the amazing veterans that were receiving either their first or their second service dog. And we observed them their second day with the service dog, working on commands and building that bond with each other. And I was able to sit down and conversate with 2 of the veterans. And I'm just going to share a little bit of their stories. So one of them shared that he was a medic in the Vietnam War, and he has PTSD and very high anxiety. And he would have the same night terror every single night. So he was unable to sleep. He was sweating, very anxious. And his first service dog from ECAD as well helped him. And he would nudge him at night to wake him up. And soon enough, those night terrors stopped. And that was his goal. So he was able to reach that goal with the help of this service dog. And another veteran shared he was very anxious to be out in public and to talk to people. So he didn't have much of a social life as he did before being in service. And now receiving his first service dog, he was starting to already feel like he was going to change his life. So he practiced going out in public the 2 weeks during the training at ECAD. And he even went out with me and my classmates to a restaurant, and he shared with us like, wow, I haven't been out in public and really like talking with people this comfortably before. And Josh is really helping me bring me at ease. So I thought that was amazing. And overall, with the experience I had at ECAD, I was able to see how it aligned with the mission that occupational therapists have, which is enable people of all ages to live life to its fullest by promoting health and prevent or live better with injury, illness, or disability, whether that's visible or invisible disabilities, which I think is very important to mention as well. Occupational therapists focus on independent living and helping an individual get back to doing the things that they enjoy most in life. And that's exactly what ECAD has done with their amazing service dogs. So overall, the experience was very eye-opening and it was great.
Great. Thank you, Stephanie, so much. And we know that you had a wonderful experience, and the veterans really enjoyed having the students there. I got to see them when I did pause and breathe, and they really valued having you there as well. So hopefully we will continue and strengthen this experience. So we're going to shift gears a little bit under the umbrella of assistance animals, and my colleague, Dr. Elijah Salzer, is going to speak a little bit about animal-assisted interventions, it's important for you to know that a service dog may participate in animal-assisted interventions, which can include therapy, activities, and education. A therapy dog is not a service dog. And Elijah's going to talk a little bit about that as well. So you guys are on.
Hi, everybody. I'm Dr. Elijah Salzer. I'm a professor of physician assistant studies here at Pace in Manhattan, as well as a physician assistant in obstetrics and gynecology. And my experience being part of a therapy dog team really came by accident when my spouse and I rescued a Shetland sheepdog in 2009. And he happened to have been a therapy dog in his previous home in New Hampshire. In fact, the people who owned him had 3 other Shelties, all of whom worked as therapy dogs. And so knowing that history, my spouse, who is a retired obstetrician gynecologist, but was still working at the time, and I decided to pursue that line of work. And so Bart became certified with us through the Good Dog Foundation. And the Good Dog Foundation works here in New York, in Pennsylvania, Massachusetts, and Connecticut, with certification of therapy dog teams, which is at least 1 dog and 1 human. And they work in all sorts of settings: schools, nursing homes, residential treatment facilities, hospitals, and disaster areas. There were good dogs at September 11th, and there were good dogs at Sandy Hook and other such tragic sites to bring healing and comfort to people. When Bart passed away, we realized we needed another dog in about half an hour. And so we got Benjamin. And Ben is now 6. He is a Sheltie. He's under my desk right now. Let me see if I can entice him to come over here. Come on. He's being camera shy. All the dogs are being camera shy too. Anyway, I'll get him. And we got him certified very quickly. And Ben is kind of made to be a therapy dog. He's a very, very calm dog. And everybody comments on that. So he has been working as a therapy dog since he was about 1.5 years old, and really seems to enjoy it. Ben's experience has been working at Pace during exams and at other times with students here. All of our students at Pace know him quite well. A good friend of his is Spirit. They really enjoy seeing each other when Spirit comes to campus. And he has also worked at Juilliard, and he works once a week at New York Presbyterian Lower Manhattan Hospital, right across the street from Pace, which is ironic because I worked there for 4 years as a staff physician assistant in OBGYN. And when they opened that campus up to therapy dogs, I applied, and Ben and I were both interviewed. And I said, well, where are you planning to put us? And they said, oh, Labor and Delivery wants a therapy dog. And I said, those are my people. Those are my colleagues and my friends. So Ben and I visit there once a week. And in my experience, the people who benefit the most in the healthcare setting from a therapy dog, and again, these dogs are there not to perform tasks, but to bring comfort to people. But the people who seem to do the best with them and welcome them the most are the staff. And certainly we know that in the last 2 years, people working in healthcare facilities of all types desperately need the affection and the unconditional love that a dog can bring. And so Ben is roundly welcomed every time he visits. In fact, we were there Friday. Joanne, is it possible for me to share my screen? Because I have a photo that I took on Friday. That would be great if that's okay. And so here he is, surrounded by a bunch of nursing staff on labor and delivery at New York Presbyterian on Friday. And we'll be there again later this afternoon. Come here, buddy. There you go. Let me get you on. So we are recertified every year together. Ben needed to learn some basic commands similar to ECAD in that he has to be really not rattled by any kind of medical equipment. crutches or canes or wheelchairs or walkers, people who might act differently from someone who is neurotypical, someone who might walk with an unsteady gait or speak a little bit more loudly. And he needs to know some basic commands: down, stay, sit, stay, that kind of thing. And he does all that flawlessly. I'll tell you one thing, he is a Sheltie, and they are herding dogs, and he loves to herd. And he loves to herd balls at home, especially things like those therapy balls that people sit on. And one day before the pandemic, he and I were visiting a patient in labor who had a birthing ball in the room. And as he was in bed with her, I suddenly saw the birthing ball and I thought, oh, what if he sees it? He's going to start barking. And he didn't. He never responded to it. And dogs are very, it really matters where a dog is and how the dog responds. If it's out of context, they probably won't. But I think he knows what he's doing. I think he knows what his purpose is. I can't prove that, but I think he does. So he's a great therapy dog, and he's a wonderful dog in general.
Thank you, Ben and Elijah. So just want to add a few comments before we open up to questions and perhaps hear from some of you the ways in which canines are assisting in your health or the experiences that you have. So when we look at the evidence, there has been a long evidence history in terms of how canines are assisting in health. And in fact, the evidence of canines assisting in health goes back to ancient times, even into the time of Socrates. During the time of Socrates, there's writings about dogs guiding people who were having visual challenges. So it's interesting to note that it was in 1929 that guiding dogs for the blind was actually formalized. It was a little bit later, in 1975, that Dr. Benita Bergen established the role of the service dog, which has grown and grown and grown since 1975. In 1977, the role of the dog for people with hearing challenges was established. And it was in the 1960s that Boris Levinson, a psychologist, accidentally found the ways in which dogs could be helpful. He was working with children who are on the autism spectrum who were not verbal. His dog Jingles, who happened to be named the same as Freud's dog, wandered into the therapy session, and the child started to interact with Jingles. Well, he thought, that's very interesting. I wonder if that might happen again. And so he tried it out. And indeed, it did happen. He developed an abstract, which he presented at the American Academy of the American Psychological Conference in the 1960s. It was in New York City, and he was actually laughed out of the room for this innovation. Well, here we are today with mounting evidence for the ways in which animals are able to assist in human health. One of my mentors, Dr. Erica Friedman, who did the first research in this area, did research where she was studying engaging animals with patients who had congestive heart failure. And they were studying hard measures, not just self-reports, but biological markers. And they were finding positive indications for the patients who were interacting with the dogs as opposed to those who were not interacting with the dogs in the case of patients with congestive heart failure. So I'm not sure if you're aware, but when we look at dogs, we actually have a release of the hormone oxytocin, which is the bonding hormone. And that in and of itself can make people feel good. I will tell you that when Spirit is out and about, just in his normal day-to-day activities, people stop, they look at him, they pick up their heads from their cell phones, and they engage in some way with him that makes some difference because you can see the look on their face. So that's just casual, right? Just something that's happening naturally with humans and dogs. But we also know that when we are studying this and on self-report measures for stress and for pain, we are able to see reductions when people are working with dogs in an intentional way. We are also able to see ways in which animals can benefit humans. We've just completed a survey of close to 250 people teamed with service dogs to better understand the benefits of service dogs. And service dogs may help the person to be able to decrease medications. They help to decrease home health services and a variety of other things. So this is a growing area. I'm happy to say that we are helping to develop the evidence and the knowledge in this area. And we would love to hear the questions that you have or the comments that you have. So why don't we open this discussion up about how canines can assist in human health? Anybody have any questions, or are there other things that the panelists would like to add in, since we may have a few minutes to do that?
Well, I just wanted to say how much I enjoyed the presentation. It was so interesting to hear about all the different roles that these dogs can play. But I have to say, as a dog owner, I wasn't at all surprised at the therapeutic benefit of dogs. But I guess what it really reinforced to me is just sort of how backward the healthcare system is in terms of being and thinking creatively about other ways of providing therapeutic benefit. I mean, you described this as non-pharmacological, which I think is pretty accurate, because so much of healthcare stems around, pharmacological interventions and surgery. But in a way, this is such a no-brainer that it would be beneficial, and especially for healthcare workers.
Thank you, Bo. And, I think that that's very true. Last week on Thursday, Spirit and I were visiting at Westchester County Medical Center. And the healthcare provider that we were visiting with and had a meeting with really needed that kind of interaction that day. And so much recognizes the importance that canines can bring to humans. Asked if we could go visit the head of the department and the staff in the department. And so unexpectedly, we did a department visit that day. And each person had an opportunity to stop and interact. And each person after that, independent, because they were in different locations, were like, I didn't even realize I needed that, but wow, I feel so much better now, thank you, right? And so there are big differences. A couple of things that are important to point out, from a non-pharmacologic intervention perspective. We as healthcare providers, those of us who are prescribing providers, we don't write prescriptions for service dogs or for therapy visits. But what we do is we make recommendations. And just like the idea of you would never give a living creature to someone who hasn't expressed an interest in that, you would not request, if you will, a service dog for a person. The person has to actively engage in that. Same thing with therapy animal visits. So when the therapy teams do their visits in healthcare settings, they're usually checking in with the nurse manager of the unit, and they're identifying who are the patients that would like to have a visit. So we don't force animals on anyone. What we do know is that there's about 95% of the people in the world who really do like interacting with canines and other animals. And so that tells us that there are some individuals that this may not be appropriate for. We also know from the biophilic theory that it's very normal and it's very natural and it's very healthy for humans to be interacting with animals. And the further we are away from nature, including interaction with animals, the more impact that can have negatively on our overall health. Another thing I want to clear up for you is the category of emotional support animals. So emotional support animals have been very prominent in the media over the past several years. It has quieted down since last year, and I'll explain to you why. So an emotional support animal is a person's personal pet who is working with that person to provide emotional support. That person may or may not have had a letter written for them about the emotional support animal. Psychologists are often people asked to write these letters, physician assistant, nurse practitioner, physicians. And sometimes those letters are very important because it allows the person who's living in a housing situation that has a no pet clause to challenge that pet clause. Up until last year, emotional support animals were allowed in the cabin of airplanes outside of a carrier. This became a real problem, and the different organizations that work in this area had spent a lot of time working with the airline industry to change that. And the importance of that is an emotional support animal, which could be a dog, a cat, a bearded dragon, a peacock, right? It could be any kind of an animal, was literally coming onto the plane with the person. That animal is not required to have any training to be able to be in those situations. So if you think about it for a minute, let's say someone has a dog that is their emotional support animal, and that dog is pretty much at home with that person. Now that person wants to get on a plane. So the person has the dog with them because of the emotional challenges that they have, and theoretically they have an emotional disability. They're going to travel on a plane, but the dog's never done this before, and the person is nervous about doing it. There's a lot of transferability between the human and the animal that they are working with. So that is not a really good recipe to bring the animal and the person onto a plane. What was starting to happen is you could get on a plane. I remember flying back from one of my animal conferences at University of California in Davis. There were 6 emotional support animals on my red-eye flight, and they were not behaving very well. There were no service dogs on that flight. It was not uncommon for people traveling with service dogs to have their service dogs be threatened and attacked by emotional support animals. It's also not hard to imagine that there are faux emotional support animals and there are faux service dogs. And so as healthcare providers, we need to have an awareness of what the characteristics of a service dog should be, and what the behavioral aspects of that is. And that's the work the Canines Assisting in Health has been doing since 2016, educating into professional healthcare providers so that we understand what a service dog behavior is supposed to be. We understand the questions that we can ask the person in the public setting, what that changes into when we're in the patient-provider relationship, and how to provide support. Because even service dogs, even Spirit, theoretically could be in a public setting and not be having a good day. And so someone could say, if the dog was barking, if the dog was not behaving appropriately, that you would need to leave the setting. So we wouldn't refuse care to the patient. We would ask them to please leave and remove the dog and then return for their care, or come back the next day because maybe your dog is just having a bad day. So emotional support animals now are not allowed on airplanes outside of a carrier, but the Fair Housing Standard laws still allow that if a person has a authentic emotional support animal, an animal that a healthcare provider is certifying is required for that person does have the right to challenge a no pet clause in court. They don't always win, but it does open up the possibility for them to be able to do that. So there's a lot of information for us as healthcare providers that is really critical for us to be able to support and advocate for people who are working with service dogs and for people who are involved in animal-assisted interventions. When we began this work, something that Louise said that really has been the framework for what we do is that when it comes to people who are teamed with service dogs, healthcare providers tend to be reactive instead of proactive. And so our work is aimed at making healthcare providers proactive. And I can tell you that in this service dog survey that we're analyzing the data from, approximately 50% of those surveyed said that their healthcare providers understood about service dogs and helped to advocate for them, which is wonderful. However, it tells us that the other 50%, that is not the case. And so it really helps us to see the necessity of the work that it is that we are doing and to hear the feedback from our students. So our students just participated in our Canines 101 last week. It was a fully virtual experience, and they had a cafe where they were interacting with other interprofessional healthcare students. And they were asked this very question: how do canines assist in human health? And they highlighted all of the things that we've been talking about today. And they also talked about having their eyes opened to the importance that canines can make in the health of the patients that they will be caring for. So, any questions for us? It's almost time for us to wrap up.
I have a question, Joanne.
Sure. Hi, Jess.
You mentioned that, you would never pair a service dog with a patient, or, force a service animal on a patient if it's not something that they were interested in. But how do you open that conversation to patients so that they can express an interest? Because I would venture to say probably a lot of people don't know what the benefits of having a service animal could be to them. And are there specific conditions or, patient populations that you see this being most beneficial in?
That's a lot to answer. Let me see if I can do that in a very,
4 minutes.
very concentrated way. So a person who is going to be teamed with a service dog has to be actively involved and engaged. As I mentioned earlier, the welfare of the dog is critical. They have to be able to care for the dog. Service dogs who come from accredited organizations, so Assistance Dogs International is the International Accrediting Association. They are the gold standard, and that is why we work with ECAD. They are accredited. They've been actively involved in ADI. And so they meet all of the standards. They go through a full accreditation, just like we do with our healthcare programs. So the beginning of this is if you, as a healthcare provider, recognize that there are things that a service dog may be able to assist the person with, and you think that the person has the capacity, then it's certainly a good thing to include in the conversation. A service dog is not for free. So service dog organizations, it costs anywhere between $25,000 to $50,000 to breed and educate and team a person with a service dog. The commitment that the organization makes to that team is that they will always work with that team for the life of the dog or the person, whichever is longer. And so what that means is when a person has a disability, disabilities are often progressive. And so a person may go to their team training and 3 years later, they may need to be back and retraining with that dog. So it's a lifetime commitment that's made to that team. So the person has to be able to have resources, or some of the organizations do have grants. And particularly with veterans in the summer, the PALS Act that Luis got started many years ago was passed. And the PALS Act will allow for $25,000 payment to an accredited organization to team a veteran with a service dog if they qualify. To qualify, you have to have capacity. So if a person has a service dog, let's say they're crossing the street, they have to be able to have the ability to safely get themselves across the street as well as that service dog. And that's part of what goes on in public access training to make sure that the person has the ability to do that. But an accredited service dog organization wouldn't get to that public access training if they had not done an in-depth assessment to make sure a person qualifies. So the person needs to go through a whole qualifying interview, which is can be a several-hour interview. It is more in-depth than any of the assessments that we do. I can tell you that for sure. There are a lot of steps in the process, and the best thing to do is if the person has an interest and you think that there would be a good indication, ask them to do a search and see what are the accredited organizations that are closest to them geographically, and then put them in touch. Their websites have all of this information on it, and they will then speak with somebody at the organization and they will begin the process with them. So thank you for your question. And all of that information is in the article that we had published in the Journal of Interprofessional Education and Practice a few years ago. And it's also in a handout that we have called Fast Facts on Service Dogs. Thanks. So if we have no more questions, Professor Spirit and I and all of our canine companions and panelists would like to thank you for joining us today. Please know that if you have questions after you have digested what you've heard, reach out to us. We are very, very happy to talk to anyone who would like to talk about canines assisting in health. So have a great rest of the day, everybody. Thanks for joining us.